Okay, let's move to the new question, and this is all about murmurs. This is a simple explanation of murmurs with concept, and it will helps you when you got confused in the exam. Okay, explaining all the simple murmurs, and it will clear your concept when you read the murmur part in from your book or from your notes. Okay, so the important part there is S1, there is this is S1, okay, and this is S2, and the middle phase is systolic phase, okay. As you remember all by your basic, this is the systolic phase and this is the diastolic phase, okay. Systolic phase happen due to closing of tricuspid and mitral valve, okay, and the S2 phase means S2 occurs due to closing of aortic and pulmonary valve. Simple. The ejection click means you can remember by a simple thing that blood is ejecting out due to pressure from the ventricle. The first sound that is appeared after S1 or the sound that is appear after S1 is ejection click. It is the opening of aortic and pulmonary valve. Important line. Remember this by heart. And after the S2 there is sound that we listen. This opening of mitral and tricuspid valve. It is the opening snap. Okay. It occur in the diastolic phase. The ejection click is occurring in the systolic phase. Remember this. Okay. After that, if you see that in the systole, blood goes out. Okay. And the pressure is rising slowly in the systole as blood is going out. And if remember or imagine that this wall, which is normal, now this wall is shrinkage in size. Okay. By the calcification or by any cause, if the size is shrink to decrease or size is decreased, then you will see that the pressure that is generating is uh, will produce some sound, okay, due to turbling of sound, you can say, due to turbulence of sound, okay. So you will see that the pressure is increasing in the ventricle slowly, and when the pressure is maximum, the sound that is audible in the stethoscope is the maximum, and then it will decrease. Though this is the crescendo decrescendo murmur, that it is increasing and then decreasing. Because why? Because the pressure in the middle of the stole is the maximum, okay, and as the blood is ejecting slowly, the pressure, the murmur is increasing in sound, and that is decreasing. It is seen in the aortic stenosis or pulmonary stenosis because the blood is pushing out from the ventricle. Blood is going out from the ventricle in the and want to go into systemic circulation from the aortic wall and pulmonary wall. Okay, in the stenosis part, there is the which murmur? It is the systolic murmur. Okay, mid systolic murmur you can say. Okay, or crescendo decrescendo murmur. If this blood is going continuously, means blood is leaking continuously, from where it can leak from the tricuspid and mitral valve. Okay, as the pressure of the ventricle is always, as the pressure in the ventricle is always greater than atria, the continuous leaking of blood is there in the systolic part. From starting, it is leaking in the upper part. As the pressure is the pressure is slow, and it is continuously leaking with the same intensity because the hole is small, and that's why this is known as tricuspid regurgitation and mitral regurgitation. It is continuous murmur. Okay, this is continuous murmur. If we see the diastolic part, in the diastolic part, if you imagine as the systole is finished, just imagine that the systole is finished just now. Okay, as the systole is finished and the blood just coming back from the aorta and pulmonary wall. Because why? Because the aorta and wall are not coming close together and there is some space left and the blood is regurgitating back. It's known as aortic regurgitation and pulmonary regurgitation. In this phase, you will see that this is just happening after the systole is finished, just after the systole is finished. So this murmur is known as early diastolic murmur. Okay, but if this is occurring in between, when the pressure is building up in the uh, when the pressure is building up in the atria, or you can say ventricle, the pressure is building up like this and going, and the valve are not pressure is building up and the valve are not completely opened. Okay, so this is known as mitral stenosis and tricuspid stenosis. In this phase, you know that the aorta is not pushing the pressure in the starting part, atria is not pushing the pressure in the starting part. Okay, so this is the murmur that come in the mid phase of the cycle. It is the mid diastolic. Okay, in the diastolic phase, the blood is flowing, but in the starting, the blood not so much to give pressure. Okay, it is the mid diastolic pressure. Okay, for the continuous murmur, you have to remember that the aorta and vein, this the blood is continuously is there because of you will see the left over fluid or leftover blood is some concept is there, and the murmur is continuous. Continuous murmur means that there is remember the difference between the continuous murmur and pansystolic murmur. Okay, the pansystolic murmur is here. It is seen in the tricuspid and mitral regurgitation because blood is leaking continuously in the part. Okay, this is not the continuous murmur, it is a pansystolic murmur. Okay? And this is the continuous murmur, mean it is also seen in S1, S2, in both, seen in both phases of the atrial systole and diastole. Okay, this is a little hard topic to make you understand, but see this video 2 and 3 times, and you will cover the last 2 3 year question from this murmur part.